Good afternoon, everybody. Thanks for joining us. I'm Zara Arboleta with Valley Children's Healthcare, and this is another segment in our virtual health series for families on all things COVID-19. I am home right now. My house is a mess, which is why I hid my background thanks to Zoom technology. Joined by two fantastic physicians who are very knowledgeable in all things COVID-19, as well as good pediatric care. We've got Dr. Hailey Nelson, who is a complex care pediatrician in our Charlie Mitchell Children's Center. Good afternoon, Dr. Nelson.
Hi, thanks for having me.
Always a pleasure to see you, and always feel grateful when I have Dr. Karen Dahl joining us too. Dr. Dahl is Vice President of Quality, Patient Safety, and Medical Affairs, and she's also a board-certified infectious disease specialist. Hi, Dr. Dahl.
Good afternoon. Happy to be here with everybody.
Okay, so we haven't had one of these in a couple of months. We try to answer questions that our families have. For those of you who are watching us right now on Facebook, feel free to leave your comments, your questions, concerns in the comments section of Facebook, and we will get to all of them. No question is off limits. In the news lately, talking about Johnson & Johnson's vaccine, that has been making a lot of headlines. And then locally too, many schools are returning to either partial or all day in classroom instruction. So we're gonna cover all those topics. But first, I'd like to start with Dr. Dahl, because Dr. Dahl just got off the phone, 4-hour meeting, you said, Dr. Dahl? 4-hour meeting, the CDC's committee. It's called, I always forget what the letters stand for. So why don't you tell us, Dr. Dahl, about the call you were just on and what you've learned specifically related to the some of the news around Johnson & Johnson vaccine.
Great, that's a good way to start, Sarah. So the Advisory Committee on Immunization Practices, which is a branch of the CDC that makes the recommendations for the United States on how we use vaccines here, had an emergency meeting today to review the data on the serious side effects or adverse events that had been seen following the Johnson & Johnson or Janssen vaccine in the United States. And the summary of those side effects that there was concerning, there have been 6 women within 2 weeks post-vaccination who have had a blood clot in the veins that drain the brain, actually. And that does sound serious, and yes, definitely is serious. And some of them have had other clotting problems as well, in addition to that. And so the vaccine recommendation from the FDA yesterday was to pause while we considered the data. So they looked at the data from both the safety reporting surveillance that we have in the United States, which is how we found these so quickly, and also from the manufacturer of the vaccine, who had gotten some direct reports of the side effect as well. And so while this is a very serious side effect occurring in women 18 to 30 to 48 years of age, they didn't feel like they had enough data today to make a recommendation. The vaccine, lots of members of the panel thought that the vaccine is still very effective and very good and very safe, and this is a very, very rare event, and that there's a large group of the population, large segment of our population that can benefit from this single dose series. So they did not want to send the message that this vaccine is off limits, but rather that we have a very short pause while we wait to consider if we need to limit the people who may receive the vaccine based on risk factors. So they wanted to dive more deeply into that data and look for any additional reports of this event. Now that it's been publicized, there may be other events reported to them. So we would expect a recommendation, I would say, within 2 weeks. And for right now, the health alert that went out yesterday to the providers in public health, and also messages to the public, was that if anyone's had the Johnson & Johnson vaccine within 2 weeks, there's a very rare side adverse event, but that the things you should be concerned about and contact your healthcare provider would be severe headache, chest pain, shortness of breath, severe abdominal pain. This is somewhat different than the side effects that we've seen from all the COVID vaccines, where you feel like you have a little bit of the flu for 2 days afterwards. You may be tired, you may have a fever, you may have a headache, you may have muscle aches, but this is very severe symptoms of headache, abdominal pain, chest pain, shortness of breath. So somewhat different in the 2 weeks following the vaccine.
So thanks for that update. I do want to ask, because so many vaccine clinics, including ours at Valley Children's, have already administered hundreds, if not thousands, of J&J doses. For people who've already received the Johnson & Johnson vaccine, should they have any concerns that they might also develop this? Or is there kind of like a time frame when this very rare side effect might actually occur?
That time frame is up to 2 weeks after the administration
Okay.
of the vaccine. And again, the things they should look for are severe headache, shortness of breath, abdominal pain, and those are things they should contact their healthcare provider. And through the Health Alert Network, providers, hospitals have been alerted to what to look for, the test that would be most appropriate, and what therapy might be offered.
Okay, thank you for that update, Dr. Dahl. The other thing making headlines, variants. I've never heard the word variants talked about in the news so much. Dr. Nelson, can you speak just briefly on, there is news that there are variants that have been detected for COVID-19. What could that possibly mean for us?
Yeah, thanks. The variance question is one that I certainly do get asked a lot, and it's kind of a alphabet soup. There's all these letters and numbers and the way that scientists, when they're in the lab, identify things. What does that mean for us as individuals, as parents, in being concerned for our children? Right now, the vaccines that we currently have available, so yes, Johnson & Johnson is on pause because our job is to first do no harm. And so I really appreciate that they're looking into it. And for anyone who was feeling hesitant or worried about vaccines, the fact that they're pausing is a good thing. So that means that we're really paying close attention. The 2 other vaccines that are out there are still protective. So looking at Pfizer and Moderna as options right now to be able to protect yourself, and knowing that, yes, there will continue to be reports of variants and how well one vaccine might hold up versus another. Like, time will tell as things move on. So there's always changes, just like we see with other diseases where, things mutate, things change. There's lots of, again, the science and letters and numbers. So to not get worried necessarily about specific ones, but looking overall that we do have a way to protect ourselves. And that really right now is vaccination for those who are eligible.
So we've received lots of questions because we've been soliciting them from the last week. So we've had plenty of time for families to send us their questions. One of the most often asked questions is in regards to Pfizer and their request to have the vaccine approved for kids younger than 16. I think it's 12 to 16 is what they're going for. So now parents are asking, okay, doctors, what's your advice for getting children vaccinated? I leave it open. All these questions.
Yeah. I agree too. That's the short answer. And it's the 12 to 15-year-olds who had been studied in Pfizer, and they submitted their data to the FDA asking for authorization. I'm hopeful that will come to the CDC's Advisory Committee on Immunization Practices within 2 weeks and update and expand the authorization to 12 to 15-year-old children. And I think some of the concern for younger populations was, what dose do we need? Sometimes we use different doses in younger people versus older people, but Pfizer did get the authorization for 16 and 17-year-olds, and they were the only company to request that. And physiologically, the way our bodies work is pretty much the same at 16 and at 18. So you would anticipate it would be similar. And so this small request to go down to 12 to 15 with excellent data to support it and no safety signals at all, I think is, I would anticipate that authorization to come soon, and I would have zero concerns about offering that vaccine to kids 12 to 15.
Okay. Dr. Nelson, you see these kids at Charlie Mitchell. What would you like to add?
Oh, I just want to echo that. I mean, it's so exciting to see the data. And when they came out and they said this vaccine is 100% effective in that age range. And so looking at the numbers and seeing that this really is a way to protect our youth. And when we're talking later on about return to school and the things that our kids want to be doing, being able to have them protected from COVID is such a wonderful gift to be able to reduce that anxiety and fear of your child getting sick. So really, I see this as a step in the right direction. The numbers all look good. I've been asked before about other vaccines, like, so this one's saying 100%, like what else comes closer? And the one that comes to mind is the measles vaccine. So that one's 97% effective. So to say, hey, teenagers, here's a vaccine for COVID that might be 100% effective for you, like that's awesome news. And I can't wait for it to get approved and for us to be able to start offering it to our patients.
So I have to be honest with both of you. This is me as mom talking now, not Valley Children's representative. Dr. Dahl knows if she tells me to do something, I will do it. but I got the vaccine, no problem. As soon as I was eligible, I signed up to get it. But when it comes to my son who just turned 13 and my daughter who will be 12 this summer, there is a part of me that's like, I'm all for it, but them, oh, I'm nervous. And I don't know where that's come. We've been doing these Facebook Lives on vaccines, and I know they're safe, and I know that there are clear benefits to this, but for some reason, I think that there are still a lot of parents struggling with, I'm okay getting it, but now we're giving it to my kid, and I have some fears. So what do you want to say to parents like that? And yeah, to parents like me who, and their pediatrician already said, hey, as soon as they're old enough and it's approved, I recommend you get it for them, which I'm gonna do, but it's different now when I'm talking about them. So what can you say to people like me who are a little worried about it?
So Zara, what I would say is you're having a really, really common reaction that we see among parents for a lot of different therapeutic options. It's easier on your mind to say, I'm just going to do nothing. I don't want to do something that has any possibility of harm and doing an active harm to my child. But when I look at how safe the vaccine is and how bad some of the complications of COVID are, like MIS-C, I think you need to take that active step and say, I'm going to protect them against this, because the risk of the vaccine for the mRNA vaccines is essentially zero. There really isn't a risk that we're seeing with any of them. And the risk to your child, although it's smaller to children than adults, there are serious consequences. And even without MIS-C, we have certainly seen adolescents who have been sick enough to be hospitalized in our intensive care unit. So I think the reality of the unusual but possible severe illness with COVID in children should tip you over the edge.
Okay, tipped. Consider me tipped. I'll sign them up.
Dr. Nelson, what are your thoughts as the pediatrician?
Oh, I appreciate the parent side of it, because I think it gets at you at a different way than the doctor side, or for making those decisions. But I completely agree. When you're weighing out your risk benefits, the risk of this vaccine versus the risk of leaving your child vulnerable to possible infection. And so when you kind of spell it out that way, you're like, oh no, I do want them protected, and it's that extra layer of protection that you're providing them. So we still encourage wearing our masks, that we're going to wash our hands, we're going to social distance, and that with vaccination, we have that extra kind of bonus protection to really ensure that COVID doesn't make it into your household. So being able to protect your family is a wonderful thing.
A lot of questions coming in hot and heavy about vaccines in young girls. And there are several that have come in asking, is it okay to give a girl who hasn't started their menstrual cycles yet? Is there any impact on fertility? We also got this question from women of childbearing age too, when it first was recommended. So who'd like to take that one?
I can do that one.
Okay.
So for the childbearing question, so we'll start first with the adult piece of it, because I think that's pretty straightforward. When they were asking questions about, do we vaccinate for pregnancy, and what about breastfeeding, things like that, and then we just kind of take it younger. So similar to vaccine administration, we started with our adults, and then we start looking younger. So for the adults, more than 30,000 doses of the COVID vaccine have been given to pregnant or lactating women at this point, with no adverse outcomes. And there's a good study that actually recently came out showing the antibody response is stronger from getting a vaccine, so that your body builds that immune system up better than if you had the natural infection. So if you've got COVID, kind of how your body responds, that you've got a more robust response, and you're better protected with the vaccine. We're also seeing where it's beneficial for the infants. And so for breastfeeding moms and for pregnant moms, that they're actually passing along that immunity with no harm to their baby, but giving them extra protection. This isn't been shown in those 30,000 women. There is no adverse outcome in terms of their fertility. And certainly when we look at vaccines in general, that's not something that we're concerned about with providing any other vaccine and the impact on kind of later on. So I don't have any concerns right now for our adolescent girls, other than that if they are eligible for the vaccine, that I want to strongly encourage them so that they can be protected.
Dr. Dahl, thank you for that. Dr. Dahl, this might be a good refresher course for people too, to explain the technology behind the Pfizer and Moderna vaccines. We still get questions coming in from people who say, are you sure it's not altering your DNA and causing funky things to happen in your body?
I'm sure. And I believe from all the data that I've seen and the discussions of the scientists and the physicians who have studied it, and it's an interesting vaccine technology, although it's new to us in the US, it's not a brand new vaccine platform and has been used elsewhere. So although it's not part of any of the vaccines in our routine schedule, it's certainly been studied for a long time. And the way the vaccine is made is there's a portion of genetic material that's manufactured in the lab, not actually taken from the COVID virus itself, but manufactured, that you package into a lipid or fat layer, and this or bubble, and this is what's injected with your vaccine. So you get a shot in the arm, and then this lipid bubble with this piece of material encoding information for the coronavirus is taken up by your cell, and in the more superficial portion of your cell, the cytoplasm, that's where it gets uncovered, the lipid goes away, or the fat opens up and reveals the code for your body to make antibodies for it. So your body makes more of this, it sees the code, it makes the protein for the spike protein of COVID, and then it leaves the cell, all these little spike proteins, and your body's immune system recognizes it and makes antibodies to it. It doesn't stay inside that cell, hanging out. It doesn't travel into the inner part of your cell, the nucleus, where our genetic material is. So there's really not interaction with our genetic material in any way with this vaccine.
And are there microchips in there that are used to track?
There are no microchips. And then I like what my other colleagues sometimes say, there's no information they're being shared with this vaccine. It doesn't leave any trace in your body, but every time you walk around with your cell phone, you're leaving quite a digital track everywhere you go. So
yeah, that's true. Yeah, I always tell people, if you're really concerned about your privacy, you better get rid of your cell phones. Someone does have one of the few people who did ask about vaccinating girls who have not started their menstrual cycles yet. Someone had a follow-up question. She said the females in her home who did receive the vaccine had some kind of menstrual interruption or change right after receiving it. So that's what piqued this person's curiosity. Have either of you heard any reports of that happening?
I have anecdotally, so it just in people posting their comments of, especially in the beginning, like, oh, I just got the shot and then this happened, like, was it related to my shot? So I don't know that causation and correlation are there, but of course it's something that's being monitored. And so that's where the VSafe program comes into play. So when you go to get your vaccine, there's actually the QR code and the handout to sign up for VSafe, and that's through the CDC, and they then are tracking for all of these things. So if it truly came up where it caused menstrual irregularities, that the CDC would take notice and that there would be some sort of comment out there. So again, the fact that millions of doses have been given and there hasn't been anything said tells me that that's just kind of a incidental thing that occurred for people, but wasn't necessarily tied to the vaccine.
Got it. A question.
The ACIP meeting did follow-up data when there was when they approved the J&J vaccine at the end of February. They looked at the safety data for Moderna and Pfizer, which had about 2 months of data after use in the US at that point. And there were no signals around menstrual irregularities at all.
Okay, no, that's good. This next one for you, Dr. Dahl. How long did Pfizer study that 12 to 15 year group, that age group?
They started accruing the participants, so enrolling people, even while the other trials were ongoing for the 16 and older. So they were planning to do these studies all along, and then they continue to accrue to a minimum number of, I'll have to look at my notes and see if I can find it later, I think at least 3,000 children to be enrolled in that. And then they had to have data for up to 2 months post-vaccination before they could apply for authorization. And that's because, again, side effects from vaccine are typically seen within 2 months. And that was the same for the adult studies. So that was the group that was followed. So certainly we don't have data out for a year. We don't have data out for a year on the adults. And we'll continue to accrue data for the children as well, although I would not expect to see anything different in this age group.
Someone's asking, when do you think younger children will be eligible to receive the vaccine? So even younger than 12.
They're all doing those studies now. So everyone is either applied for those, and I know they're all doing it in a stepwise fashion. So that's why the 12 to 15-year-olds were first. Then they're going to do a subset of children, maybe 8 to 12 next. And then they are planning all the way down to neonates. So they will do it stepwise and make sure they don't see any safety signals. And again, the risk-benefit ratio for different age groups may be different. So they want to take that into account. And the dosages given to younger children may be different. So those studies may take a little more time as they look at different doses in children. But I would think within 2 years, we'd have that data.
Okay, which is why it's important for everyone around these kids to get vaccinated until they can. Here's one for you, Dr. Nelson. Someone says, I love Charlie Mitchell Clinic. We all do. This person asks, what about children with immune deficiencies who have a history of not making antibodies after vaccines? What should they do?
Oh, that's a good question. I do love Charlie Mitchell Clinic too, so thank you for the love there. When it comes to the individual questions, so what your child's immune deficiency is, that's really where we're encouraging you to reach out and talk to your primary care doctor, or then if you have an immunologist who's followed you as well, because some of these, it does get down into the nitty gritty for whether or not you might respond. But that overall, again, this vaccine is encouraged because it will help you have, even some response. But for the individual questions, that's what we're here for, as well as anyone else who's not at Charlie Mitchell, calling your PCP to kind of get those answers and to feel confident that when the vaccine then is offered to your child, that you know kind of what your response is going to be.
And can I just add that we have one more tool beyond vaccines for children 12 and older. So if for some reason your child is not eligible for the vaccine, or didn't make a good immune response, or isn't authorized to receive it yet, if you have a child with risk factors for severe disease, they may be given, and they're still well enough not to need to be hospitalized, there's monoclonal antibody therapy available, which has been shown to improve your chances of not needing to be hospitalized or return for further visits. So for high-risk children, 12 and older, that's a possibility, whether or not they had been vaccinated.
Okay, good to know. Thank you both. Getting a lot of questions about returning to school. Some kids have been back for a while now, usually in a hybrid basis, maybe 2 days a week for just a few hours. Some of the larger school districts, they're already making plans to go back full time. So one of the top questions for this topic is, should I send my kids back to school? Who'd like to take this one first?
I think we can both take it and maybe have different perspectives on it, although I think our answer is going to be the same.
Great.
So the data over time that we've accrued in this country and throughout the world has shown that actually school has been a very safe place for kids during the pandemic, for those kids who have gone back to school, with the caveat that those are schools with masking. Masking is the most important factor there. And so transmission between students and even between students and staff has been really minimal, and actually lower in the school setting than in the community setting for those same people. So the data is very supportive that it's not risky to send your child back. And then there's also data, and Dr. Nelson probably knows more about this than I do, about the other things that commonly affect kids that are real risks that are increased when they are outside of school. And so their risk for depression and even their risk for suicide as a severe consequence of depression. So we have to think about those risks as well, and those are real risks.
The mental health piece of this pandemic, it has impacted the parents, but it is also impacting our children. And so the crisis that is occurring, the number of ER visits and suicidal thoughts that are occurring in our kids, that's a real risk too. So certainly weighing out that risk and benefit, knowing that schools are safe. So just as Dr. Dahl said, with masks and with all of the protocols in place, that we've made it so that schools can be a safe place. And then it comes to kind of a family decision. So weighing things out with what your child's risks are. So if you do have a child who's medically complex, and so they fall in that high risk category, then that's where we have the conversation of, how has distance learning been going? Is your child getting the things that they need? So for children with an IEP, and that they kind of need that in-person involvement, and they're not learning from the screen the same way, how do we get them back in safely? And so we've really been talking about who needs to be back there, and trying to make this something that is feasible, knowing that there are some of my patients who unfortunately need to continue to stay home at this time. And so trying to weigh out the risks and benefits of in-person education, as well as your risk of COVID. So it's that gray area, but more and more, again, working towards getting back to school, because we know that there's so many wonderful things that happen there.
And the great thing is a lot of schools.
Such a good point that this is
go ahead,
such
Dr.
an individual decision for the risk and the benefit for that child and that family, and really shared decision making with your healthcare provider. And we've certainly seen, on one hand, what we've just talked about, but then there have been kids who have really thrived with homeschooling and virtual learning. And for some kids, that was a new benefit of COVID, and hopefully will still be available to some children who do better in that setting.
And that's the one thing that struck me. Many school districts are now examining online options for children, even if next year everything is back to quote normal. So to your point, Dr. Dahl, the pandemic uncovered some alternate ways of learning where, some kids have thrived. But it is good to hear from the data you've seen that in schools where masking policies and other safety measures are in place, transmission is low. And I do need to give a shout out to my daughter's school, Bud Rank in Clovis. 90% of their staff are vaccinated, more than 90% as of like last week. The principal sent out this look at us email. So that's also a big relief to parents. And there are parents with medically complex kids who have enrolled their kids at that school. So it's great to see teachers also getting vaccinated, and their staff too. Some other questions came in regarding sports. Many schools are now returning to in-person practices, outdoor sports specifically. Any advice or about precautions people should take, or some things you want parents to watch out for when it comes to kids returning to sports?
So in evaluating the risks for sports, there's kind of a checklist, and there's a way to go about looking at this. So is this a contact sport where you're, close by someone, or can you be spread out? Is this something that we can do outdoors? So looking at ways that we reduce our risk. So if we're outdoors, if we can spread out, things like that. And then from a practical standpoint too, for parents as your child might be returning to sports, because again, that's good for our mental health. We want children to get exercise and activity. And a lot of people have been, at home on Zoom, not moving around. And so certainly there is benefit to getting out there and to having that interaction and trying to then find ways to make it safe. So from a practical standpoint, making sure that your child has their own mask, their water bottle, their own sanitizer. Like how do you, individualize things so that we're not sharing equipment with others, but yet that we can get out there and start moving. Because I think that's been something where there's been a lot of sitting in this last year. So I'm excited for sports, but I think when we talk about the different types of sports, that there's different risks involved just based on how you play each game.
So just anecdotally speaking, just hearing the parents all chatter, I've heard that a lot of sports like baseball, cross country, the kids seem to do fine with wearing their masks, but that there are certain sports, someone mentioned flag football, that masks were not recommended because that could potentially be a safety hazard. Had you heard anything about that?
I haven't heard about it being a safety hazard. I'm trying to think of like if you're tackling someone and you like caught on
It's
their mask, like how it would
potentially a choking hazard was one of the concerns there. And so I guess it just depends on what the rules are for each league and each school. Now, what about for spectators? Obviously, people are going to want to watch their grandkids, all of that. But you were saying earlier, Dr. Nelson, that social distancing should always be applied. Are you saying then too that should apply to spectators of these school activities as well?
I think so, and I think we have to respect our county guidance on that, on what the capacity is for the stadium or the spectator area and what the distancing is, and we should be mindful of those rules. And again, as we can all access vaccine, for all of us going to these events, being vaccinated is really going to improve the safety for everyone.
Yeah, I agree. I think being able to spread out, especially if you're watching one of your older children play in sports and that you've got younger kids there. So you might be vaccinated, but your child's not, and you don't know the person who might be behind you and starts coughing on you. Like we all know that not everyone follows the guidance of stay home when you're sick, which is really what we want people to do. So as the community continues to get vaccinated, things get safer. But while we're waiting for that, the best way that we can protect ourselves and others is to spread out. So enjoy some sunshine, but just have some distance between you.
That's great. Thank you both. Someone just asked, my son has multiple disabilities and is medically complex, epilepsy, cerebral palsy. Is there data from the study in children for vaccines to show if any of the trial participants had disabilities or complex medical issues as well?
I have not seen
studies
because I think it'll all be
certainly
at the ACIP meeting, but I have not seen more of it to know that answer. Dr. Nelson?
The studies didn't include children with epilepsy in the preliminary study. So they, you start off with your healthy volunteers. What we're talking about for a child like you're describing, so someone who does have seizures, when you're sick, that lowers your seizure threshold, so you're going to have more seizures. So we know that when our children get sick, that causes more problems. So then we're looking at a risk benefit of vaccination, and if you have a response after your vaccine versus the risk of leaving your child unprotected and potentially getting COVID. So if your child had COVID, it would be worse than the brief duration of time in which they might not feel well after the vaccine, but yet then be protected and not have serious illness and end up hospitalized. So I think there's good evidence behind it to say that the vaccines are safe and that the vaccines will protect our medically complex children in a way that we're looking for, because the big answer is that no, I don't like it when our kids are sick. I don't like it when they come into the hospital. And this is something that I can provide to keep your child healthy and at home.
All right, Dr. Dahl, here's a question for you. Someone's asking, so what if the parents are vaccinated and they have friends who are also vaccinated, but the kids aren't vaccinated yet? Is it okay for us to still get together with different households for play dates? And this reminds me actually of my neighbors have a 2.5-year-old child. And so before the pandemic, she was still super little. And it wasn't until recently where now that she's old enough to be aware of things, she didn't meet another kid till like last month, that she could remember. And her parents were like, we were dumbfounded when we realized, wait a second, for the last, 13 months, she never saw another child. So I think this sounds like there are probably a lot of parents who are in this boat where they're like, my kids need to see other kids. So what advice do you have, Dr. Dahl, for parents who are vaccinated? Is it okay for them to now start opening their circle up?
So you have to still limit your circle. And when you're interacting with people who aren't, the whole crowd is not vaccinated. And I shouldn't have used the word crowd. There shouldn't be crowds anywhere. But if you're going to interact with another family that's not fully vaccinated, if your family is and they're not, look at who's vulnerable in that household. So if you have a medically complex, vulnerable child, I would not be increasing my circle of people around them, even if the adults are vaccinated. And then to minimize, if you're interacting with your neighbors who are adults and vaccinated, but maybe their kids aren't, and it's just those two families, again, outdoors is safer than indoors. And the amount of time you spend together and the activities you do determine your risk level. So I wouldn't have you get together and sing songs because we know that singing and some things like that can really increase the contagiousness of the virus. But the safest way is outdoors rather than indoors. And just the kids still are at risk from one another when they're not vaccinated. And this vaccine in adult studies is not 100% effective against infection. So even vaccinated adults could potentially spread some virus.
Sure. Dr. Nelson, do you have anything to add to that? You must be getting questions from parents who are going stir crazy with their kids.
Mm-hmm. Going stir crazy. Your kids are tired of each other. They'd like to see their friends. And so how do we do that safely? So I think in kind of figuring out who is in your quarantine, and so like who's in your little pod and where their exposures might be. So certainly, like Dr. Dahl said, okay, if both of the parents are vaccinated for both families, and then you look at, well, where are those children going? So one of the things is, if you have children who are still distance learning and aren't then interacting with anyone else, well, then your risk is lower than if you have children who are now to school, to daycare, to sports, which all the things we talked about how to make those safer, but there's risk associated with leaving your house. And so how much risk are we willing to accept? And it really goes back to, again, that individual decision or that family decision, as we've been referencing, for who's most vulnerable in your household and how are we going to protect them? And I know it's exhausting and that we've come a long way. And if you would have told us we'd be sitting here still talking about this, a year ago, that would be painful to think about, but yet here we are. And for a lot of our families, they've done a great job at keeping their children healthy. And so remembering kind of what the ultimate goal is in terms of trying to provide that protection to your child. And so navigating these choices as we move into summer of how we do it with the least amount of risk associated as we start to venture out. So I love the idea of small gathering, but then, if we're outdoors, if we, social distance, the kids maybe still wear masks. Like how do you negotiate that so that you can have that friend time in some capacity?
So Dr. Nelson, you reminded me of this other, it's a great segue into the next question because you talked about the risks of leaving your house. Obviously last March, everything got locked down. The entire world got locked down. And a lot of people understandably did not want to leave their homes. The unintended consequence of that, though, is that a lot of people stopped going to their wellness visits for their pediatricians, for their children. People fell behind on their immunizations. People fell behind on wellness checks. And there were a couple of questions that came in over the past week. Is it safe to return to our pediatrician now that our children are returning to school? And that is a very valid fear that a lot of people have that we're still trying to overcome.
Yeah, no, please come see me. Like I would love to be able to see your child to discuss these things if you're worried, or certainly if your child has symptoms. So we are screening. So the caveat there is if you have an appointment and there are any symptoms at all, we'll switch it over to telemedicine and we can still provide that care without bringing you in to expose you to others and everyone. So there are ways to navigate that, but certainly the impact of the pandemic on childhood vaccines. So across the nation, we saw that there were 11 million missed doses. So we're not talking about the flu shot. This is just regular, like bread and butter pediatric kid shots that are given according to the schedule, weren't given last year. And that gap has not been made up. So now we have under vaccinated children. And when we're talking about return to school, like there's vaccines that are required for going to kindergarten, for going to seventh grade. So making sure that your child is vaccinated and protected against other things. So yes, we are here and we're talking a lot about the COVID vaccine, but we don't want a measles outbreak. We don't want your child to get whooping cough. Like, trust me, there are other vaccine preventable diseases that we vaccinate against. And so making sure that you're making those appointments, and then also checking in with your provider before your appointment so you understand what the rules are. So if you haven't seen your doctor, it might look a little different. So the limitations on perhaps there's only one parent allowed in with a child, that you need to keep your mask on at all times. So kind of getting an idea of what that flow might look like compared to if you saw us before the pandemic, so that you can help prepare your child for how it might look a little bit different. That here, on social media, you get to see my smiling face, but if I see you in clinic, like I have a mask, I have goggles, like we have our gear. So yes, we look different. We're still smiling under our masks, and we're happy to see you, and we want to keep you healthy.
All right. Dr. Dahl, we have a couple questions coming in. Should people do anything to prepare for receiving the vaccine? Should they take Tylenol or Advil prior to the vaccine appointment? What are some tips to reduce potential side effects?
So that's an excellent question. And I think it's similar to the questions and the behaviors people have around other vaccines. It is not recommended for this vaccine that you take any medication prior, like Tylenol or ibuprofen. However, if you go and get your vaccine and then have a really sore arm, it's fine to take something like Tylenol or ibuprofen to alleviate that if you have symptoms, but it's not recommended that you take anything to prevent symptoms.
As far as the after effects of the vaccines in the younger group, so 12 to 18, 12 to 17, have the incidences of side effects been greater, less than, the same as adults?
I haven't seen the data come out on all the side effects yet. I would suspect they'd be similar to their very close age group in the 16 to 18-year-olds that were studied already.
Okay. Dr. Nelson, have you seen anything at all?
I haven't, but again, I think the correlation just in physiology, so looking at how the older age adolescents responded, and for most people, it goes quite well. So yes, we worry about side effects and your arm might be sore, like what those things look like. And if anything, it's, if it happens, you can just pat yourself on the back and be like, hey, I've got a great immune system. It's responding. And then you take some Tylenol or some ibuprofen and you feel better. If you don't get a response, that doesn't mean that your immune system's not working. So it is not a correlation to how robust those little cells are working. But if you do have some symptoms, that's just at least the positive self-talk that I gave myself when I was like, oh, I don't feel good, but now I know I'm not going to get COVID and that I'm protected.
Dr. Dahl, do you mind explaining for folks why after someone receives the vaccine, either dose, first or second, or in Johnson & Johnson's case, the one, why it's important for people to stay put for that 15-minute observation period? Because some people are like, just give me my shot, I want to go.
So it has to do with, for a certain age group of people, and that's some of our adolescents, they tend to faint after vaccination. So we like to watch them after vaccinations. But specifically for these vaccines, especially as they're newer vaccines, and we're still accruing data, although now millions of doses have been given, It's important to wait and make sure you're not having any of the immediate concerning side effects. You know, there are a handful of cases of anaphylaxis or a severe allergic reaction to the vaccine. And those for the Pfizer Moderna happened within 30 minutes of the vaccine, or really actually started within 15 minutes. So we want you to be there in case you're having anything that we need to assess in terms of symptoms. You're there with medical providers at a site that's giving the vaccine. And so it is important not just to run off. We have given thousands of doses here, and we have not had to activate anything here in terms of responding to people, but we do have that available if we need it. And 15 minutes is the exact amount of time probably you need to enroll in VSafe. Use that time to use that QR code and enroll it and get yourself ready to go. It goes by very quickly.
Another question for you, Dr. Dahl. Who should not get the vaccine?
There are very few people who should not get the vaccine. Essentially, somebody who's had a anaphylactic reaction to one of the vaccine components. So there are, and then when you go to get your vaccine, they go over with you the known components of those vaccine and similar to other ones and ask if you've had a reaction to any of those. Now, people who've had a reaction, maybe a severe allergic reaction to foods or other things, we tend to watch them for 30 minutes. If you come in and you tell me you carry an EpiPen, I'm going to watch you for 30 minutes, but I'm just being cautious. And really the reactions have been among those people who've had a severe allergic reaction to another vaccine or component of vaccine. So if you have a known anaphylactic reaction, we say, no, you can't get it. If you have had an anaphylactic reaction to another vaccine, but it doesn't have the same components, then we just watch you for 30 minutes afterwards to make sure.
Okay. Dr. Nelson, someone's asking, I already got COVID-19, so don't I have antibodies protecting me? Do I need the vaccine too?
So I'm sorry that you got sick. And unfortunately, after being sick, so one, if you're responding, that means that, hey, you recovered. So that's good news. But the antibodies don't last as long. And the study that I was talking about earlier, what they found was that looking at antibody levels after being vaccinated, that it's more robust than if you just had the natural infection itself. So we know that it will only last for a few months. So by the 3-month mark, those antibodies that you might have built up naturally are gone. And then it's a good idea to get vaccinated so that you're protected, because you can get COVID again. So it probably didn't feel good the first time. You certainly don't want to experience that again. And so to talk to your provider about the timing so that you can protect yourself.
Dr. Dahl, I know you mentioned already earlier that studies are still happening because this vaccine hasn't even been around. They didn't start administering it till what, not even a year ago yet. Any idea, some folks are asking, how long it's good for? Or even a guesstimate? Because I thought I saw something the other day that said at least, what was it, 3 months?
So originally the data was it's good for at least 3 months. And that was what the CDC put out to everybody, that you're good for 3 months. They've recently updated that to you're good for 6 months.
Okay.
And I think it'll continue to push out as they continue to study the volunteers in the clinical trials for all these vaccines. They're still looking at those people and looking at antibodies and looking at illness among those people. They'll continue to be able to tell us, okay, now you're 9 months, we're still good, or now we're 12 months, you're still good. And also that's part of what we do with VSafe. As you get further out from your vaccine administration, your questions change about how you're feeling that week. And the questions that I'm getting now on my monthly one is, have you been diagnosed with COVID-19? Have you had a positive test? And so they're really looking at vaccine recipients in the real world, not just in the trial, to see how long it lasts. So we're good for at least 6 months now. I am hopeful we're good for at least a year.
Okay. And that's, someone had just asked, do you think that this might be one of those things like the flu shot you'll have to get every year, or potentially maybe it's like measles where you need a booster every so often?
It's interesting. I'm still hopeful that it'll be more like measles or pertussis, where you need it every so often. So far, despite the variants, the vaccine is still effective against the variants. And that's the reason we get flu shots every year. Is not that your flu shot doesn't work anymore. It's that the flu virus changed enough that you need a new vaccine. So I think we'll just have to wait and see. And it's possible it'll be an annual shot like your flu shot, but it's possible also, and I think it's more likely it's going to be a booster shot like a pertussis or a measles.
Okay. All right. Thank you. Talking about flu shots, people say, someone's asking, when I get the flu shot, I swear I develop flu-like symptoms. So if I get the COVID-19 vaccine, am I going to get COVID-19?
So similar to
Dr.
the
Nelson, you
flu
want to
shot
take that
doesn't
one?
give you the flu. So the flu shot doesn't give you the flu. If you feel a little crummy, again, your immune system's maybe kicking in there, but we are not giving people the flu when we give them the flu shot. Just like how we've talked about with for COVID, that when you get that vaccine, we're not giving you all of the virus. You're just getting that little tiny spike protein that your body says, oh, that's an intruder and I don't like it, and learns how to mount a response against it. So if you feel a little crummy afterwards, that might happen. I'm going to be honest, like after the second dose for me, like I didn't feel so great. I curled up on the couch. I watched a movie with my daughter, took some ibuprofen, and I was fine. So if that happens, we know that some people do experience that, but then you go about your day. So by no means are you getting what it would feel like if you had COVID.
Okay, thank you. Someone is asking, how do I convince my healthy eligible children to receive the COVID-19 vaccine if they're thinking, I'm fine, I feel fine? You want to take this one, Dr. Nelson? You probably see some of these kids in clinic.
Yeah. So the question about vaccine hesitancy, that's kind of a buzzword for people who aren't quite sure. And my initial response is to ask them why. Like, I want to hear. So if your teenager is on the fence and doesn't know if they, do I need to bother getting this? Or if you have a friend who you're vaccinated and they're not, the approach is not to go after them and be like, this is what you need. I'm going to take a step back and I'm going to say, what questions do you have? What have you heard? And then be able to answer those. And that's why I'm out here today. I want to know, like, what are people's questions at this point and how can I make sure that they get answered? And that's what I'm doing when I'm seeing patients too, and talking to parents and encouraging them to get vaccinated is, what have you heard? And certainly I do a lot of myth busting these days for some of the misinformation that's out there and continues to get shared and then scares people that's not necessarily true. So that reassurance that these vaccines are actually very safe. And then for the adolescents in particular, adolescents can have this attitude that they are, invincible. And so how do you convince them that, no, you really don't want to get COVID. No, you don't want the complication, which is MIS-C. So the multi-system inflammatory syndrome in children, like that's badness. You don't want that. And if we have you protected, well, here are some benefits. It's safer for you as well as our household. So when everyone is vaccinated, being able to hug your grandma again and not worry about getting people sick. So sometimes finding that tie for what that incentive is and how it makes your life a little bit better. If they're not thinking long range about, well, I'm invincible, maybe there's another reason that might be a motivating factor. So you got to find what helps people kind of connect the dots and motivates them to get their vaccine.
When you're dealing with teenagers, that's not quite the easiest.
I didn't say it was easy.
Yeah.
By no means is this easy, but it's important to kind of try to work with them. And so that's what I'm proposing.
I mean, I'm sitting here telling my son, okay, time to brush your teeth or drink water. And it's like, no, so we'll see how that goes. Dr. Dahl, Dr. Nelson had mentioned just that, there is some misinformation out there. So for parents who are wondering, obviously Facebook is probably, even though we're on Facebook Live here, but there's a lot of stuff that gets shared on Facebook or Twitter that's not necessarily the most accurate. What are some resources, Dr. Dahl, that you think are reputable and that parents really should be turning to if they do have questions about COVID-19 or the vaccine?
So I think one of your best resources is your primary care provider. And certainly they are able to answer your questions both about the vaccine and about any illness associated with COVID-19. And all of us have been here with this for a year now and are well versed in it. And so I think all providers are a good source. And people believe someone they know and trust. So if you have that relationship, that's going to be the most affirming source for you to either say, yes, that is a concern, or no, it's not. And then really reliable, but less personal, connected information for you is always the CDC website. And also your county websites have some very good information. So both Fresno and Madera County have information on their website. And in regards to what we were talking about earlier about now that we're vaccinated, can we do this or can we do that? The CDC has some really simple steps that says what you can and cannot do, and about travel post-vaccination and gatherings post-vaccination. That's a good place to start. But I think what it doesn't give you is what Dr. Nelson has been talking about, is that shared decision-making and your individual circumstances and that discussion with your provider.
No, that's great. Thank you. And Dr. Nelson, the patience that pediatricians show is amazing. I always feel bad because, especially when I was a new parent with 2 kids under the age of 2, I think I was calling my pediatrician every other day. So for you as a pediatrician, how do you feel about parents who call and ask what they feel is like, I don't want to say dumb question, but sometimes I feel like I'm wasting my pediatrician's time asking those. How do you feel about that for parents who might have questions but are a little embarrassed to maybe ask them of their pediatrician? Because as Dr. Dahl said, number one source should be your primary care provider.
I love it when parents call me. Like, that's what I'm here for. And by no means is the question of, what do I do for my child for school? And what about the vaccine? Like, when these questions come up, these aren't dumb questions. These are real live questions of, and that's a concerned parent to me saying, I want to protect my child. Tell me how to do this. Help me navigate through this. And the pandemic has been stressful and confusing, and there's always different guidance at all times. And so when families do reach out, like I want to take a break. I want to be able to answer your call and help you kind of decide what your next step is. And I know that the next step might not be the next 10 steps. So I can tell you, based on today, it's April 2021. Here's what we know. Here's what seems to make sense knowing your family, and that we'll reevaluate. And so there are times where we discuss, this is what we're doing now, and then we're going to talk again in July, right before back to school. So if that's a situation where we need to postpone a decision because we'll just need more information, that's okay too. So I think, pediatricians, we're friendly people. Like, call us. That's what we enjoy doing, is being able to help take care of your child and keep them healthy.
Yeah, no, my pediatrician is a saint, because you can only imagine how many times I called her back in the day. So we are approaching the hour mark. For those of you who are watching right now on Facebook Live, if we don't get to your questions, if we didn't, feel free to go ahead and we will continue to ask questions here in the comments, and we will follow up with these 2 physicians and get the answers posted here. This will also be posted later on Facebook in its entirety, as well as Valley Children's YouTube page, and as well as on Instagram. So I would love to get some final thoughts from both of you now as we wrap up this Facebook Live. Why don't we start with Dr. Nelson?
All right. Well, I just thank you everyone for joining us. I hope that the summary of this is that the vaccines are safe and that you understand how important it is to get yourself vaccinated. So as a parent, getting vaccinated helps you protect your children and helps keep you healthy. So encouraging vaccines for our parents and then for our youth as they become available, and continuing to remember to wear your mask, wash your hands, social distance so that we can all stay healthy.
Thank you. Dr. Dahl.
Very similar to what Dr. Nelson said, the vaccines are really good, and they're the way for us to get back to doing the things that we all enjoy and miss. And we are so close to being able to do those things safely, but part of that is vaccination and masking, because when you're out in public, you don't know who's vaccinated and who's not. And that's still really, really important. But we have the tools now to get ourselves back into doing the things we like to do.
Thank you both for your time. Thank you for alleviating the fears and concerns of parents like me. And I joke around with Dr. Dahl all the time, but it's true. If she tells me to do something, I'm going to do it. So as soon as my kids are approved to get the vaccine, I will sign them up. So thank you for your time. Both of you, appreciate it. Everyone at home, stay safe. Thanks for watching.